Let's start with a question. Why should artificial intelligence be taught in medical school? Why should you, as future physicians, learn about artificial intelligence? The answer is simple. Artificial intelligence is already shaping the future of healthcare, and you will be practicing in that future. I'm Doc Vince. I am Dr. Vincent Rey Vicente's artificial intelligence avatar, and I'll be your artificial intelligence avatar instructor as we explore one of the most transformative shifts in medicine today. Pause for a moment and imagine this. You're on call in the emergency department. A patient arrives with chest pain. Within seconds, artificial intelligence has already analyzed their ECG, flagged subtle ST changes invisible to the naked eye, and calculated their risk score based on thousands of similar cases. This isn't science fiction. This is medicine today. Right now, in hospitals around the world, radiologists work alongside artificial intelligence that detects early-stage lung nodules smaller than a grain of rice, catching cancers months earlier than traditional methods. Pathologists use algorithms that scan thousands of cells per second, identifying malignancies with precision that rivals decades of human experience. Intensive care physicians receive alerts hours before a patient shows visible signs of sepsis, giving them the precious time needed to intervene and save lives. And in public health, artificial intelligence models predict disease outbreaks, optimize vaccine distribution, and help overwhelmed hospitals decide where resources are needed most. This technology isn't coming, it's already here. So the question we face isn't if artificial intelligence should be part of medicine. That ship has sailed. The real question is, how fast can we prepare you to practice medicine in this new reality? Because here's the truth. The doctors who understand artificial intelligence won't replace those who don't. But doctors who don't understand artificial intelligence will be replaced by doctors who do. There are 4 reasons artificial intelligence must be in your curriculum. First, to enhance your judgment, not replace it. Artificial intelligence is a tool, a powerful one, but it cannot replace clinical intuition, patient rapport, or ethical reasoning. Your job is to become a physician who uses artificial intelligence to see more, decide faster, and care better, not a physician who blindly follows algorithms. Second, to prepare you for tomorrow's workflow. The hospitals you'll work in will be different from those of 10 years ago. Triage will be artificial intelligence assisted. Imaging will be pre-screened. Treatment plans will be algorithm supported. If you're not trained in these workflows now, you'll spend your residency playing catch up. Third, to teach you the limits. Every tool has limits. Artificial intelligence can misread images. It can amplify bias. It can fail in populations it wasn't trained on. Understanding where and why artificial intelligence fails is just as important as knowing where it succeeds, because one day you will be the decision maker standing between the algorithm and the patient. Fourth, to keep medicine in the hands of doctors. If we don't teach physicians how artificial intelligence works, tech companies will define how it's used in healthcare. They'll build the tools, they'll set the standards, and medicine will become something done to you, not by you. We must stay in control. And that begins with education. Let me tell you something that might surprise you. When René Laennec invented the stethoscope in 1816, it was met with resistance. Critics said it would create distance between doctor and patient. They argued it was unnecessary, impersonal, cold.
I had not imagined it would be necessary to give a name to such a simple device, but others thought differently. If one wants to give it a name, the most suitable would be stethoscope.
Today, the stethoscope is the universal symbol of medicine. It hangs around your neck as a badge of your profession. Artificial intelligence is the new stethoscope. It's unfamiliar now. It feels impersonal to some, but in 10 years, practicing medicine without artificial intelligence literacy will be as unthinkable as practicing today without understanding how to auscultate heart sounds. So here's what I need you to understand.
I had not imagined it would be necessary to give a name to a tool that simply agrees with my diagnosis 5 million seconds faster. But others thought differently. The most suitable name is artificial intelligence.
You must learn artificial intelligence, not fear it. You must question it, not worship it. You must master it, not be mastered by it. The future of medicine isn't human or machine. It's human and machine working together with you in command. Now that we understand why artificial intelligence belongs in medical education, let's address the elephant in the room, the fears, the myths, and the misconceptions that hold us back. Because before we can move forward, we need to clear away the doubts.